Hello, welcome to Truckee Talks. I'm your host, Maya Schneider, and I have with me tonight two guests. It's my pleasure to introduce you to Bonnie York. Bonnie, welcome to the show.
Hi.
And Tamara Manzigal. Tamara, welcome. Now, you're both here on behalf of Nevada County Community Health Department. Am I getting the names right here, first of all? So
That
far,
is
so
right,
good.
yes.
Let's get a little bit of background, and Bonnie, we'll start with you. Now, you're a registered nurse.
Right.
And what is your background?
Okay, I've been at the clinic for a year now, and my background is family planning. And I've also worked in the psychiatric field with adolescent and pediatrics, similar to Tamara. And I've also worked maternal child health on the floor in the hospital.
And how long have you been in the Truckee area?
I've been here for going on 4 years now.
Oh, great.
Yeah,
All
yeah,
right.
but I've been visiting for 20 years. Family has been up here, so yeah, I'm pretty familiar with the area. Love it.
It's funny how whenever you ask somebody how long they've been in the area, there's always the tag online. Well, I've only been here, but I was a
Right.
part-timer for this many years.
Right.
Tamara, you're a nurse practitioner, and what's your background?
I moved up to Tahoe to take a year off back in the 80s. I decided that to live in paradise it would be nice to have a job. I became an RN and went to work down in Reno at the same facility where Bonnie works sometimes or has worked, and realized I wanted to be a nurse practitioner and work and live up in Truckee. So I became a nurse practitioner and started working here in Truckee in '99. And now have been working at the Nevada County Clinic for a few months now, doing their women's health and youth clinic program, and just am really loving the opportunity to really be involved in the community.
Now, let's talk a little bit about the kinds of programs that are offered through Nevada County. I'm not sure that folks are really tuned into the variety of services that you're offering. So, Bonnie, let's pick a favorite.
I have a
start
list.
there. I'm not surprised.
I do. I more than anything, I work in family planning with Tamara, and another nurse practitioner that we have is Janet Brooks. But we have so many other different programs too. And Tamara will probably cover the women's health, okay, because that's primarily what she does. But we also do the TB diagnosis, treatment, and follow-up, and that's with Dr. Cutler. He has a clinic on Thursday afternoons. I think it's like once a month. And we do the skin testing, so people can come in and get skin tested for the TB to see if they've been exposed, and if they've been exposed, then they'll get sent in for a chest x-ray.
Now, let me stop you there
Sure.
for a minute. What is the prevalence of TB? We sort of think of TB as the disease that's come and gone, and we don't think about it as being evident anymore in our communities.
That's funny that you feel that way, because that's really not true.
Not the case.
No, not really, no. We have, like I said, the clinic is once a month up here, and it's only an afternoon, so it does occur. It definitely does occur. So, what do you think the statistics are?
I think it's emerging more from underdeveloped areas where it just was never really well controlled. And then as people move to this area, they're bringing it from, they're bringing the tuberculosis disease from other areas. So we're still finding that if we can identify it before there's a true outbreak, that we're mostly treating it preventively.
Okay.
So,
All right.
Definitely.
definitely.
So that sounds like an important program. What's next on your list?
Well, the screening too. I
Okay.
definitely want to mention the screening. You can come in and it's a $10 test.
Okay.
Okay. Tobacco prevention. Toby Prusak is in our office, and she has a class, and it's an 8-week class. And I think there was 6 or 7 adolescents actually are in her class, and she had 3 that quit, which is surprising. And it's still kind of in its infancy, but she feels very successful. I mean, to quit smoking is so difficult.
So when I hear tobacco prevention, I'm also thinking chewing any kind of tobacco product.
She does focus more on the
Smoking.
Yeah.
So anybody that might be interested in quitting using
I
tobacco?
have her phone number.
Okay.
It's 550-3001.
And again, a service offered through Nevada County.
Right. Yeah, definitely. Do you have anything else about the tobacco?
Just that we encourage anyone who is having a challenge and wanting to quit smoking that you utilize the services, because the program is there for you as a benefit to your health and welfare, and that's why we're there.
That's why you exist.
And we would support that through, when you come in for a woman's health visit, and we're concerned about you being on the birth control pill and being a smoker, then we consider that an adjunctive service. And oftentimes women who come in and they want to be able to utilize a birth control measure will say, oh my goodness, this is a wonderful opportunity to have support in quitting smoking.
That's great. That's great. Sort of cross-checking
Oh,
the
absolutely.
various needs. Okay.
Routine immunizations.
And when we're talking routine immunizations, are we talking about children and infants here, or?
We do all of them, everybody. For the adults, the adults that come in, generally they're coming in either for the Hep B series.
Hepatitis B?
Right,
Okay.
hepatitis, sorry.
That's all right.
And also the hepatitis A. The hepatitis A is more for the travelers and also for the children, actually. The kids are at high risk for hepatitis A because it's hand to mouth, and kids are notorious for not washing their hands. But the hepatitis B is for anybody who's going to be in contact with bodily fluids. It's a great series to get. It's a series of 3. We offer it for $40 each shot, and I think if it's private pay, it's over $100 someplace else. So it's really economical to come to us. And we also have the Hep A/B combination. Yeah.
Now, do you work with other providers such as the Tahoe Forest Hospital District and work with their team as well?
I don't think we reinvent the wheel. I think there is immunization that's done there as well, and other services. You know, one thing I wanted to add to what Bonnie brought up, if you qualify for the Family Pact program, which is a family planning program through the state of California, the hepatitis B series is covered as part of treatment under that. So a lot of times people will not have to pay if they qualify income-wise. So that's
good to know.
Yeah.
Okay.
So and if you are sexually active and you are concerned about possible exposure, then that is an option for you.
Well, now you brought up a trigger word, so I'll jump to that. What about STD testing?
Yeah, that's our next page.
Okay.
Can I just go back to the tetanus? I just
Sure.
wanted to kind of throw that in there really
Sure.
quickly. The tetanus shots, generally people are kind of wondering how often that they're needed, and it's every 10 years unless you are in some kind of like if you step on a nail or get a serious burn, then you get it every 5 years. Okay, I just kind of wanted to throw that in there for the adults.
Okay, so let me think about this, and let's put this out there to the
Sure.
audience. An adult, once you get out of school, you kind of stop paying attention to shots and inoculations and that sort of thing. Are there routine shots that we should all be getting periodically through the rest of our life?
The booster for the tetanus is always a good idea.
Okay.
And if you're gonna go to the ER for some reason, they're gonna ask you when was your last tetanus shot. So you should.
I have to
definitely
write it down
know.
on my arm or something.
Yeah. Well, if you don't know, you might want to think
You'll
about
end up getting it
We are
again.
located at the Joseph Center. You can come visit us.
The other thing, if you are planning on traveling and you know a trip is coming up in a while, you really should plan ahead and get immunized ahead of time for the area you're going, because there are definitely preventable immunizations or disease-preventable immunizations that you can get. So.
And I would think that would depend on where you were traveling.
Exactly.
So is that information available through your department?
Placer
or-
County offers the travel shots.
Okay.
I can't even think off the top of my head but I know that they offer those.
There are
so.
different costs, and they have a program on Mondays
Okay.
to do that.
So if you know you're traveling, it's a good idea to be thinking ahead as you're putting
Definitely.
together your packing list about what you also might be doing for your own health like, before you hit the road. Okay, we're on page 2.
Okay. The STD checks. We routinely check for chlamydia. It's in epidemic proportions.
Now, and when you say something like chlamydia is in epidemic proportions, what constitutes an epidemic?
You might know
Is
the
that a
answer to that,
percentage
nurse
of the
practitioner.
population? Or?
We are concerned, I guess when I practice, I like to look at everyone as an isolated risk. And when I see a young woman or a young man and their risk of a woman's risk of infertility as a result of a long-term infection that was not identified, when you look at chlamydia as a sexually transmitted disease, in a majority of people, over 70% oftentimes, people are not symptomatic. And you may be somebody who identifies yourself as somebody who, you know, your partner's, oh, they're clean, everything is great, and you could be unknowingly carrying and transmitting the disease, and I don't want to be a doomsayer here, but it's in the unlikeliest places, and it does occur. And I don't know, I've probably seen 3-4 cases in the past few months. To me, that's significant in terms of every individual.
And the size of our
significant.
population and the number of people that come through your department.
Absolutely.
Exactly.
Absolutely.
So in the STD testing, you have chlamydia testing.
Right.
And treatment?
And
Right.
treatment.
Okay.
Effective.
Yeah,
Right.
it's so easy to treat.
Okay.
So you just have to know that you've got it, and then you treat it.
And what about HIV? That's still on the top
We-
of people's lists.
Lots of education, prevention, and then we do tests, and that's on Monday afternoons. And we actually don't do that. Andy does that. So
Is that through your department?
through our department,
through
yeah.
your-
I can give you the phone number.
well, we'll have a telephone number on our screen too
Great.
for anybody
Okay,
that's interested
great,
in
yeah.
contacting Nevada County Health.
In terms of HIV testing, I think it's important to know a lot of people hate getting their blood drawn, but now it's saliva testing.
Right.
So that makes it a lot less overwhelming to think I really should go get tested.
Wow.
So,
Is that as effective as a blood test, as accurate?
yes.
And what about confidentiality? Because I think people, when they're having any kind of STD testing, they want to know, especially in a small town, that there's some confidentiality.
Right.
What can they expect if it's a clinic in the afternoon on a Monday?
We're pretty quiet. That's why we're here to try to get the word out.
That's where confidentiality is actually hurting you guys.
Yeah, no kidding. But absolutely, it's confidential. Everything is confidential unless the patient is in danger or the patient is thinking of harming somebody else.
Okay.
So yeah, it's definitely confidential. One thing I did want to mention too is the fact that when somebody calls and they said they want to get STD screening, generally they're looking for HIV testing. That's the one that's out there, and
Right.
people are really concerned about it. But our front office staff is going to just routinely put them with Tamara and myself and with Janet, and we'll check for the chlamydia. If they want the HIV testing, they have to specify that they want the HIV testing.
Okay.
Okay.
And
I just want to make sure.
Is
they
that
know
on a specific day of the week?
Monday afternoons?
Okay, so they
with
should
Andy.
call ahead and.
Right, and make an
Okay.
appointment. And
Okay.
sometimes I'm sure Andy takes walk-ins too, because we are pretty slow at that time.
Okay.
But it's definitely better to get an appointment.
Okay, so.
Yeah.
And I think it's wonderful when they come through to see Bonnie or myself, and Diane is another nurse at the clinic, because a lot of times people will come in concerned. They've had one event and they're particularly alarmed and concerned, and it's like, I just want to be checked for everything.
Yes.
And there's really no way to check for everything, but education, I've found, and just providing as much information as I have available to me often just goes, just is very helpful.
Goes
for
a long way
many
towards
people.
preventing.
Exactly, preventing and relieving anxiety, because I think we've done such a good job educating and kind of scaring people, but we still have those times where we, may not make the best decisions on our own behalf, in terms of our behavior. That if you get the information and you get the testing and you get what's available to you, that oftentimes is very helpful.
What would you say to the person out in the audience that's saying, well, it's not me. I'm never going to get this disease, or I'm never going to be affected by any of this. It's not about me.
That tends to be the younger population, of course.
The
and
immortal population.
Exactly, yeah. And while that person is saying, it's not me, I'm looking at somebody else, and then that person's looking at me. It's out there. The risks are there.
What you spoke about the educational component, Tamara. Is there any way that the county is interfacing with the school district and doing preventative education there, or is that a separate element really handled by the school
Do
district?
we
Yeah.
have Toby going?
Toby and Matt Carlson, they are great. Matt is great. He was our teen advocate, and he's been with the county for I think at least 2 years now. And he's a 20-year-old, and so he's more at that age level.
He can
He's
still
a near
relate to
peer.
them.
He's a near peer.
He has
Yeah.
a great rapport with the kids, and he actually goes to the high school and teaches, and just gets out there and gets on their level. And Toby does too. Toby's great. She's more our age, and she gets out there.
Oh, old like us.
Old like us, yeah.
You notice I throw myself in there.
Actually, she's younger than us too, but I mean, you'd never know. She's great. She's got a really great rapport with the kids, and they're out of Sierra High School too.
Okay.
So
We also offer the youth clinic on Wednesday afternoons, which is accessible to individuals 19 and under with confidential services. I consider it my personal goal when a lot of people in the community are very concerned about young women who are offered birth control. And are we there just trying to, promote sexual activity? Absolutely not. I feel it is my duty as a health provider to educate about choices and about empowerment. And when a young woman or a young man is making a decision to be sexually active, that they're aware of the risks, that they're aware of the nature of their choices, and that they make informed decisions all the way along. And I'll actually ask, are you ready for this? Is this a decision you feel comfortable in making? And so, oftentimes as a community member, I look at the parents of my friends' children, and I think, are they going to start blacklisting me because I'm providing these services? But I want the community to know that part of the services, and I feel very happy about being able to offer, is talking about these very uncomfortable subjects and trying to empower. That's our shared word. We're really about empowering these young people to get the information they need, get the services that they need so that they can make decisions for their own health behavior.
Well, it's so important to have the both of you here on the show so that we can get the word out to our local community too, that you're offering these services and the nature in which you're offering these services, so people really can get their hands around it.
And we also, I wanted to emphasize too the fact that we do tell it's mostly girls that come in, and we do tell them that abstinence is a choice too, that they can choose to say no. So
Bonnie,
that's definitely.
We're going to break away from your
Okay,
list for a minute.
that's great.
we'll come back to it, I promise. Tamara, tell us a little bit about what happens in your world over in Nevada County.
I really have. I see myself as one role as a nurse practitioner, health provider in the family planning realm in that capacity. And some community members may watch this and be confused because I also work as a nurse practitioner through the Tahoe Forest Health Services. I am also a psychiatric nurse practitioner. I do primary care, so my face is out there in the community. But specifically at the county, my role is as a women's health provider and as a men's health provider in terms of family planning and sexual health. When I see a patient, it's usually to do a woman's health exam, our most favorite day of the year. I have a great time joking with women. I think because of my psychiatric background, I can really make a woman feel very comfortable about a first visit, maybe some complaints, some concerns about infection, and make it about a visit about her choice to be there, about feeling comfortable in saying, okay, I need to do this. This is important, to get health screening, whether we're talking about breast health. We're talking about, health in terms of pap smears and cervical cancer, being able to identify any concerning symptoms that have to do with infection or cancer, let's say. We do educate about that. And overall, just looking at how a woman is doing and functioning in her life. Plenty of times I'll talk to a woman about, hey, how are you doing? So.
I think that it's always a surprise to me the number of women I know who are bright and educated but will not go for an annual exam, and it's not my favorite day of the year. No offense, Michelle, but it's not something I necessarily look forward to, but I certainly look forward to the clean bill of health.
Right.
And how do we get the word out there to other women that this is an important annual event?
I think to identify a safe place to go, I think many women feel traumatized when they get their exam. And I identify so many providers in this area. We're here for Nevada County, but certainly many women access other providers. You go to Tahoe Forest Women's Services, you go to Dr. Richards, you go to Michelle Fisher. I identify all of these practitioners in the area, Tahoe Forest Health Services, as excellent practitioners. And to identify a provider that you feel comfortable with, and maybe you go in and you say, I'm not quite ready to do this, but can we talk about this part of my health? And I think a provider who's willing to work with you, I know several women who are terrified to go through the exam process, and that should be okay. And we should not hold women hostage for their birth control needs, we do have a certain obligation to have a comprehensive physical exam when we're going to provide birth control, but definitely to make it a non-traumatic experience and to make it to let women know that they're in charge. You know, sometimes I've had women who've been victims of sexual assault, and I will give them the option to stop the exam at any point in which they can't do it anymore.
Yeah.
And by virtue of giving them the control, that's when I see that they're able to do it.
You can complete the whole exam.
Yeah.
Just briefly, what are the challenges to your job?
I think the challenges to my job right now are that I'm not busy enough over there.
Okay. Let's get some people over in Nevada County.
Oh, I'm sorry, I probably bumped my microphone. I need some more patience. The challenges are we're looking at cutting the budgets everywhere.
Sure.
But right now, I know I can comfortably offer health services and birth control, and as long as I am given the opportunity to do that, then just, you know, there are options for women in this community who don't feel like they have the money or don't have insurance.
And what do you love about your job, Tamara?
I love being there for the individuals who come in and who walk away going, thank you, thank you so much. And for those who just, I think, may go out the door and make better decisions for themselves and maybe think 10 years later, oh, you know, I probably made a good decision at that time. So.
Bonnie, how about you? What are some of the challenges for you in your job?
Similar to Tamara, we need to get people in the clinic. We definitely need, we have such great services. We have great nurse practitioners. We have great care, and we're just trying to get the word out. Sometimes it's just so slow.
Is there a target audience that ought to be paying attention to this? Is there somebody out there that should be listening?
Definitely. Low to moderate income. They qualify for our services, and actually anybody is able to come in. If they don't qualify financially, then they can cash pay. We have a huge part of our population is Hispanic, and it's great because we have a bilingual staff. Unfortunately, I'm not, but I always pull somebody in, and
We're
it's just
working
great.
on it.
We are working on it. That is really our target right now. We advertise in Moonshine Inc. and we've got
Trying to get the word out
Yeah,
there.
definitely. That's the big challenge for us is getting the word out. We have well baby exams also. And they're free, and there's always an appointment. Poor Jen Langry, she's a nurse practitioner. She also works at North Lake Pediatrics. She sits there and just waits for people to come in. At least you had at least 2 today, didn't you?
All right,
So-
so this is, let's get the word out to the
Yeah,
community. If you need health care, if you think you might need health care, if you have some questions about health care, let's not let Bonnie and Tamara sit around and get bored. They have work to do. They're in the Levon building. Again, you'll see that information on your screen, 10075 Levon Avenue in Truckee. And their telephone number, 582-7814. Don't be shy about calling them or stopping by their offices. I want to thank you both for being on the show. Bonnie and Tamara, I know it was a struggle to get you here and get the show scheduled, and I appreciate that.
It's great.
But good luck to both of you.
Thanks.
And again, audience, if you have any questions, 582-7814, Nevada County Community Health Services. Stay tuned. We'll be right back with some upcoming events in and around the region. And welcome back to the show. Here's our region's events for the week of April 9th, 2003. April 12th is the Preb Motley Masters Race at Alpine Meadows, featuring bad fashion ski suits on the Lakeview Racecourse. Call Alpine Meadows at 581-8328 for details, and be sure to see lots of green and orange out there. Also on April 12th is the Tiki Cup. This is the return of a long-standing tradition at Sugar Bowl Ski Resort, featuring Polynesian dancers, flamethrowers, Mai Tais, and more. Call Sugar Bowl for details at 426-9000. Or on the 12th and 13th, you can attend Spring Jam 6 at Squaw Valley, USA. This annual spring festival includes big air events, skier cross and border cross, a pool party, and of course the Billy Dutton uphill race on the 13th. Call Squaw at 583-6985. Also on the 13th, the historic Silverbelt Race returns to Sugar Bowl Ski Resort. This event originally dates back to 1939, almost as far as our director Jack Davis. This event was one of the precursors of the modern-day World Cup. Call Sugar Bowl at 426-9000. On April 19th, the Earth Day Festival will be held at North Star at Tahoe. This event features educational and environment booths, arts and crafts, kids activities, food, and live music. Go on out to celebrate at North Star at Tahoe. And Spring Blast is going on April 9th through the 13th. If you want information on all of the Spring Blast activities, you can go to snowbomb.com. That's snowbomb.com. And they can give you all the information on the fun things going on, including the Alpine Meadows Dummy Huck. I know a few dummies I'd like to huck. Or the Spring Blast Fashion Show, the Snowbomb Sick and Twisted Slopestyle Competition. Perhaps you want to go to the Spring Blast Highest Pool Party in the World at Squaw. There's more going on. Look at snowbomb.com. Next week's show will feature guests discussing Earth Day, and that show will be hosted by the one and only nature-loving Ted Owens. I'll be back in 2 weeks. I want to thank Bonnie York and Tamara Manzagal for being on today's show. I want to thank all of our crew and our new volunteers for showing up. If you have any comments or suggestions on the show, call me at home, 587-4982. Thanks, and we'll see you next week on Truckee Talks.